Hey everyone, welcome to Careers Out There. I'm your host Mark Luber, and we're helping you find a career that fits you. Today we're looking at the exploding career path of healthcare IT consulting, and our guest is John Chambers, a healthcare IT analyst. Here's a short clip from our interview where he starts out talking about the most rewarding aspects of this career path. Let's meet John.
I can see the impact that my work has on the hospital and the people who are working at the hospital, and that's really rewarding. That's really rewarding when you can do something for a nurse that makes her job that much easier, so they can focus more on providing care for the patient. It really is rewarding. It sounds kind of cheesy maybe, but
no, that's great. So your role in this would be what, as an analyst?
As an analyst, I would engage the client. We would talk about their current workflows, their current state. We can identify what's slowing the process down, what's costing more money, what could be possibly impacting patient care. So those are all aspects of the workflow that we're looking to improve.
Okay. And when you're working on this and you say you're meeting with the client, are you going to the hospital and sitting in the hospital with IT people that are employees of the hospital?
Some cases. Other times I'll actually be sitting next to a radiologist while they're reading films. Sometimes I'll walk around with a radiology technologist as they're performing their exams. So you can make evaluations just watching them do their job and say, well, maybe if we could get a work list on the machine, they wouldn't have to carry this paper, which means that's one less thing for them to think about. By getting rid of the paper, we can start reducing paper costs for the hospital. And then if they're actually working from that machine, that means when they've completed that exam, that information will be instantaneously available to the radiologist so that they can start reading. So we've also cut down and shortened the amount of time it takes to get that image to the doctor, back to the general practitioner, so they can start making evaluations of patient's health.
That's amazing. So you're speeding up the whole process. You're streamlining everything for all parties.
That's what we're trying to do.
Hey everyone, you've been watching the short version of our interview about healthcare IT consulting careers. If you want to see the full interview, you can go to careersoutthere.com. Thanks again for watching. I'm Mark Luber, and I look forward to seeing you at the site. Take care.